Did you know that over 500 million people worldwide are living with diabetes? That's roughly 1 in 10 adults. And what's even more alarming is that many people have it without even knowing. But here's the thing, despite how common diabetes is, most people don't really understand what it is. They know it has something to do with sugar and insulin, but beyond that, it's pretty fuzzy. So today, we're breaking it down in the simplest way possible. By the end of this video, you'll understand exactly what diabetes is, how it affects your body, the different types, and most importantly, what you can do about it. Whether you have diabetes, know someone who does, or just want to understand your health better, this video is for you. Let's dive in. All right, let's start with the basics. To understand diabetes, you first need to understand how your body normally handles sugar. Every time you eat, your body breaks down food into glucose, which is basically sugar. Glucose is your body's main source of energy. It's the fuel that powers everything from your brain to your muscles. But here's the catch. Glucose can't just float around in your bloodstream forever. It needs to get inside your cells where it can actually be used for energy. And that's where insulin comes in. Think of insulin as a key. Your cells have locks on them, and insulin is the key that opens those locks and allows glucose to enter. When you eat, your pancreas-on organ that sits behind your stomach releases insulin into your bloodstream. The insulin travels through your blood, unlocks your cells, and glucose flows in. Now, imagine this, like a perfectly choreographed dance. You eat, your blood sugar rises, your pancreas releases insulin, your cells open up, glucose enters, and your blood sugar drops back to normal. Everything is balanced. But in diabetes, this dance gets disrupted. The system breaks down, and when glucose can't get into your cells properly, it builds up in your bloodstream instead. That's when problems start. So now that you understand the normal process, let's define diabetes. Diabetes is a chronic condition where your body either doesn't make enough insulin or can't use the insulin it makes effectively. This leads to high blood sugar levels, which over time can damage your blood vessels, nerves, eyes, kidneys, and heart. The name diabetes mellitus actually comes from Greek and Latin words meaning to pass through and honey sweet. Ancient physicians noticed that people with this condition produced sweet-tasting urine because of all the excess sugar. Thankfully, we have better diagnostic methods today. When doctors diagnose diabetes, they're looking at your blood sugar levels. A normal fasting blood sugar is below 100 milligrams per deciliter. If it's between 100 and 125, that's considered prediabetes. And if it's 126 or higher on 2 separate tests, that's diabetes. But here's what's important to understand. Diabetes isn't just one condition. There are actually several different types, and they work in different ways. Let's start with type 1 diabetes. Type 1 is an autoimmune condition. This means your body's immune system, which normally protects you from bacteria and viruses, mistakenly attacks and destroys the insulin-producing cells in your pancreas. We're not entirely sure why this happens, but it seems to involve a combination of genetic factors and possibly environmental triggers. The result? Your pancreas produces little to no insulin. Remember, no insulin means no key to unlock your cells. So glucose just accumulates in your blood while your cells are starving for energy. Type 1 diabetes usually develops in children and young adults, which is why it used to be called juvenile diabetes. But here's an important clarification. Adults can develop type 1 diabetes too, and children can develop type 2. The names can be misleading. People with type 1 diabetes need to take insulin every single day, either through injections or an insulin pump. There's no way around it without insulin. Type 1 diabetes is life-threatening. Type 1 accounts for about 5 to 10% of all diabetes cases. It's not caused by lifestyle factors or eating too much sugar. It's an autoimmune condition that isn't preventable with our current understanding. Now let's talk about type 2 diabetes, which accounts for about 90 to 95% of all diabetes cases. In type 2 diabetes, your pancreas still produces insulin, at least in the beginning. The problem is that your cells become resistant to it. It's like the locks on your cells start to malfunction. The key still exists, but it doesn't work as well as it should. So what does your pancreas do? It tries to compensate by producing even more insulin. For a while, this might work, but eventually your pancreas gets exhausted and can't keep up with the demand. Your insulin levels drop, your cells remain resistant and your blood sugar stays high. Type 2 diabetes typically develops in adults over 45, but increasingly, we're seeing it in younger people, even teenagers. This shift is largely due to rising rates of obesity and sedentary lifestyles. Here's what makes type 2 different from type 1. Lifestyle factors play a huge role. Being overweight, especially carrying excess weight around your abdomen, physical inactivity, poor diet, and genetics all contribute to type 2 diabetes. The good news? Type 2 diabetes can often be managed and sometimes even reversed through lifestyle changes. Weight loss, regular exercise, and a healthy diet can dramatically improve insulin sensitivity. Some people are able to control their blood sugar without medication. Others need oral medications or insulin, but lifestyle changes still make a massive difference. This is why type 2 diabetes is often called a lifestyle disease. It's not about blame or shame it. It's about understanding that your choices can genuinely impact the disease progression. Before we move on, let's quickly cover prediabetes and a few other types. Prediabetes means your blood sugar is higher than normal, but not high enough to be diagnosed as diabetes. About 96 million American adults have prediabetes, and most don't know it. This is a critical stage because with lifestyle changes, you can prevent or delay the progression to type 2 diabetes. Then there's gestational diabetes, which occurs during pregnancy. Hormones produced by the placenta can make cells more resistant to insulin. Most women's blood sugar returns to normal after delivery, but having gestational diabetes increases the risk of developing type 2 diabetes later in life. There are also rarer forms like LADA and MODY. The key takeaway here is that diabetes is diverse. If you're diagnosed, understanding which type you have is crucial because the treatment approaches differ. So how do you know if you might have diabetes? Let's talk about symptoms. The classic symptoms include increased thirst and frequent urination, extreme hunger, unexplained weight loss, and fatigue. You might also notice blurred vision, slow healing cuts, frequent infections, or tingling or numbness in your hands and feet. Here's the tricky part. Type 2 diabetes often develops slowly, and symptoms can be so mild that you don't notice them. You might feel a bit more tired or thirsty than usual, but attribute it to stress or getting older. This is why regular checkups and blood sugar screenings are so important, especially if you have risk factors. Type 1 diabetes, on the other hand, usually comes on suddenly and dramatically. Symptoms develop over weeks and can quickly become life-threatening if not treated. Now, let's address why diabetes is such a big deal. Why does high blood sugar matter so much? When your blood sugar stays elevated for long periods, it damages your blood vessels and nerves. Think of sugar as being sticky and abrasive. Over time, it wears down and clogs your body's infrastructure. This can lead to heart disease and stroke, kidney failure, blindness, nerve damage leading to amputations, and even an increased risk for Alzheimer's disease. This sounds scary, and it should be taken seriously. But here's the empowering part. Good blood sugar control dramatically reduces these risks. Diabetes doesn't have to lead to these complications if it's properly managed. So what can you do? If you have diabetes, the goal is to keep your blood sugar as close to normal as possible. This involves monitoring your blood sugar, taking medications or insulin as prescribed, eating a balanced diet, exercising regularly, and maintaining a healthy weight. Managing stress and getting enough sleep are also key. If you have prediabetes or are at risk, these same lifestyle changes can prevent or delay type 2 diabetes. Studies show that losing just 5 to 7% of your body weight and exercising regularly can reduce your risk by nearly 60%. The diabetes community has come incredibly far. We have better medications, continuous glucose monitors, insulin pumps, and more support than ever before. People with diabetes are living long, full, healthy lives. Diabetes is serious, but it's manageable. Knowledge is power, and now you understand what's happening in your body and why it matters. If this video helped you, please like and subscribe. And remember, whether you have diabetes or are supporting someone who does, you're not alone in this journey.